So today we are going to consider the nutritional intervention I would recommend for an athlete dealing with a stress fracture. A stress fracture results from repetitive submaximal loading of the bone. Can occur in athletes of all ability levels, but they are more common in the lower extremities and more often associated with high impact activities and those sports that emphasize a low body weight. So our case study today is on a 45-year-old marathoner currently dealing with a stress fracture. She has additional risk factors. She is Caucasian, female, and over the age of 40. She also has a low body weight, and she is a distance athlete. She does have a history of another stress fracture a year or so ago, and she's currently running more than 20 miles per week on average, and averages faster than a 9-minute mile pace. And both of those variables are associated with an increased risk of stress fracture. So she may be dealing with inadequate recovery and possible LEA. So the first thing I would do is a dietary assessment. We want to evaluate her total energy intake and make sure that she is getting the food necessary to cover both her basic metabolic functions and energy expenditure. We also want to evaluate her macronutrient ratios. So she could be attempting a high-fat, low-carb diet, which wouldn't be ideal for bone health. She may be getting too much or too little of either protein or carbohydrates. And we also want to evaluate micronutrients because these are vital for bone health and bone remineralization. So the first thing I would do is make sure we correct any low energy intake. So she needs daily energy availability to be greater than 45 kilocalories per kilogram of fat-free mass per day. That's our baseline. We don't want to go below that. Levels below that are associated with an increased risk of hormonal disruption, Rett syndrome, female athlete triad, and other negative issues. So in order to make sure that her energy availability is sufficient, we want her energy intake to be greater than 70 kilocalories per kilogram of fat-free mass per day. And that may vary with her training cycle, but in order to help her accomplish that, we want to implement a plan to eat, not just a plan to train. We want nutrition to be a part of her planning cycle. So we need to do meal prep, make sure she has healthy foods available, and make sure that she doesn't delay eating, that she eats within 30 to 60 minutes after a long run. So her macronutrient ratios, we want to aim for between 7 to 10 grams of carbohydrate per kilogram of body weight per day. Protein, we want to aim for between 1 to 2 grams per kilogram of body weight per day. And then fat, between 0.8 and 1 gram per kilogram of body weight per day, just to make sure that she's really getting those fat-soluble vitamins that she needs. It's really important to emphasize whole foods when we're looking at an overall dietary plan because the vitamins and minerals overlap in all of our different food groups. So when we combine whole foods, they are more readily absorbed and are better able to help with remineralization and bone repair, specifically calcium and vitamin D. So considering some of those really good sources of calcium, she could integrate collard greens, broccoli, kale, to get vitamin D. Fish and seafood is very beneficial. So our daily intake, we want to aim for about 3 cups per day of low-fat dairy. Low-fat dairy is associated with a decreased risk of stress fractures and bone injury. We also want to aim for 3 servings of whole grains per day, 3 to 5 servings of vegetables, 2 to 3 servings of fruit, and then make sure that we get some nuts and seeds in there. At least, 1 serving per day. She can use nut milk if she is lactose intolerant, but dairy is associated with improved bone health a little bit more than fortified milks. And then, of course, we want to get that fish in there. 1 to 2 servings per week. She could do salmon, canned sardines, maybe integrate a little bit of tuna, but be careful with tuna. And then based on her age and her training regimen, she may benefit from some supplements. So while we're going to aim for whole foods first, based on her vitamin D blood levels, she could supplement with 600 international units per day, and calcium aim between 1,000 to 1,200 milligrams per day, just to make sure she's getting enough. For this particular athlete, I would also recommend that she assess and possibly reduce her caffeine intake. Caffeine has a negative effect on bone health, so we just want to make sure that we're doing everything we can to help that bone heal. In time, her prognosis is good. So if she is able to improve her diet, she should be able to heal that fracture in 6 to 8 weeks. She might need to cross-train and maybe incorporate some resistance training. But this diet should help prevent future stress fractures and help her improve her overall health and training.